Hey guys, welcome back to another video. If you're new to this channel, my name is Vimal Thomas. I'm a 4th year medical student from TSMU, Georgia. And in today's video, I'll be telling you guys everything you need to know about next exam. Next exam. Basic information you should know about next exam. So next exam is proposed by Government of India as a licensing medical examination which will constitute final year of MBBS program in India. They are replacing final year exam with next. Why are they replacing final year exam with next? So they are replacing because to make more sophisticated exam and to get more knowledgeable doctors. Now as you know, we are studying something and we are vomiting what we have studied into papers. Next exam will check your clinical skills and basically how you assess your patient, etc. So when next will get started? It is yet to be finalized by Government of India, but I personally think that it will start around 2022 or 23. Important points to remember about next. There is unlimited times of attempts, first one. Next will grant license to practice as medical practitioner and to enroll in state register. The exam will be conducted in English and maybe in some other local languages. I'm not sure about that. Next. So about next exam comes in two parts. There is next one and then there is next two. Next one, if you fail part one, you can't do internship. Which is if you fail next one, you can't do internship. This next one will be this exam will be an online MCQ exam, and this will be a 3-day exam. So on day one, you will be tested on your internal medicine plus other subjects like ortho, radio, psychiatry, anesthesia, etc. There will be 120 MCQ questions and 3 hours of time. After this you will get a break, a lunch break. Then there will be a short exam of pediatrics, 60 question MCQs in 1.5 hours. Next, day 2. There will be surgery exam, 120 questions, 3 hours plus psychiatry or and anesthesiology. Then lunch. After lunch, ENT, 60 questions, MCQ for 1.5 hours. And for day 3, there will be obstetrics and gynecs plus embryology, 120 questions, and ophthalmology, 60 questions, 1.5 hours. So the total number of questions we get for 3 days is 540 questions and the time is 13.5 hours. So along with these subjects, there will be 10% of applied basic science like anatomy, physiology, pathology, etc. and 10% of preventive measures. And now we are talking about the pattern. So 60% of the questions will be problem solving, which is clinical questions, and 30% comprehensive analysis, and only 10% recall, like the direct questions like most common cause, etc. like what is the name of this artery, etc. So before it was all recall, you study, you vomit in the paper. Now it is clinical based questions to check your clinical skills. There will be statement questions like the patient came with this and this, like they will give you the symptoms and you will have to assess the pathology or management, etc. The cutoff for next one is, we are not sure. The information is not given till now. But I will let you know when it is updated. But my assumption is that MBBS final year in India, the passing mark is 50%. So according to my assumption, that you will at least need to score 50% mark in next one to pass. So after next one, what we do? Now after next one, we apply for internship. The scores of next one will decide your internship and your PG seat, as you know. So when PG seat comes, you know that higher the score, higher is the chances that we get good seats. So after internship, what? We write next two. So about next two, it is a practical exam. They will give you a patient and will ask you a clinical question based on the patient. There is no score, you pass or fail. This will be a permanent license. This will be the permanent licensing exam. Now, how to conquer? We don't know because the whole information about next is not out yet. When updated, we'll inform you. But I can tell you something is that The questions won't be like old Medical Council of India's exams or not like NEET PG. So no use of doing previous papers. Yes, it will give you knowledge, but questions won't be alike. As I told you, the questions will be more clinical. Second, the questions will be mostly from 4 to 6 years. So study well your 4th, 5th and 6th year. Instead of mugging up, understand and study. Only if you understand and study, you will be able to solve clinical questions. Thank you guys for watching this video. If you like the video, give it a thumbs up and subscribe for more content. Bye bye.